Good morning. I'm Dr. Steve Stites, back again, Chief Medical Officer here at the University of Kansas Health System, Executive Vice Chancellor at the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites, to quote Jack Nicholson. I'm back. Have you ever visited the doctor and been asked if you are worried about having enough food at home? Or have you ever used a food bank? Those questions are to screen for food insecurity, which is one of many social determinants of health. Social determinants of health are all the non-medical factors that influence your health, like where you live, your insurance status, access to transportation, whether you have insurance, and what's the quality of the air like where you live, how much stress do you have, and as we're focused on today, your access to healthy food. Some would argue this is 80 to 85% of what determines your health. Today, we're exploring what happens when a patient says, yes, they are concerned about having enough food at home. We're going to ask how often doctors hear this answer, and we'll learn about a new program that lets doctors help prescribe healthy food to people who are in need. Joining me today is Dr. Brandon Comfort, an internal medicine physician here at the University of Kansas Health System, and someone who we've enjoyed having here before. Yeah. On the research side, I'm joined by Drs. Cheryl Gibson and Christina Bridges from the University of Kansas Medical Center. Dr. Gibson is a professor in the Department of Internal Medicine who helped design the Produce Prescription Program. Now, if I try to say that, you know I'm going to screw it up all day long, but Produce Prescription Program we're talking about today. Dr. Bridges is a research assistant professor in family medicine who has worked for years with the community organizations to combat food insecurity. And we're also happy to have Bastian Wade. Bastian participated in this Produce Prescription Program. We cannot thank you enough for being willing to come onto this program and to share your experience. Bastian, let's start with you. During a doctor's visit, you were asked about your access to food. Tell me, how was that question phrased and how was it presented to you?
So it was given to me on a sheet of paper. So like when I checked in, they gave me a clipboard. And it was a bunch of different questions, and one of them had to do with food insecurity. And I checked yes, I had issues with it, and then I gave it to the nurses. I headed back, and yeah, they took it from there.
And there are a lot of reasons to have food insecurity. You may not have enough money to buy food. You may not have an automobile to get to a grocery store. You may live in what's called a food desert where there are no, or a grocery store desert, where there are no grocery stores for many miles around. So what were you doing for food at that time?
At that time, I was using the SNAPS program, and then we used our local food bank. And then when we could, we were using the Double Book program. And some of it was just getting food kind of wherever we could get it, if there was free meals in town or if there was mobile food bank and stuff like that.
So what happened after you indicated that you were concerned about having access to food?
I was contacted by a case manager, and they called me and made sure I had all the resources I needed. And they told me they'd reach out if anything came up. And then sure enough, they did reach out and let me know about the program.
Excellent. And that's the FreshX program is right there.
Yes.
Is that we say Fresh RX program. I want to turn to our doctors just a minute to talk a little bit about that. So some people think food insecurity is a third world problem. That's not true. It's a problem right here in the United States of America as well. Dr. Gibson, help us understand the scope of the problem locally.
So in Kansas, it's about 1 in 7 individuals who indicate that they're food insecure. Closer to home in Wyandotte County, the sources indicate from about 13.5% to 18.1% food insecure. The source that I use is Feeding America, and they have about 14 to 16% that are food insecure. So it's a big problem. And communities of color, especially Black individuals and Hispanic or Latino individuals, are 18 to 25% food insecure. So it's a large problem. About 1 in every 4 Black individuals. So very big problem.
That is a really big problem. And Dr. Comfort, what about among patients getting primary care at the health system? What kind of population are we seeing there that has food insecurity?
Yeah, so it's pretty similar to what Dr. Gibson is describing. So we have about 238,000 patients now that get their primary care services at the University of Kansas Health System. We screen everybody every year for food insecurity, and about 4 to 5% year to year will tell us that that's something that they're struggling with. And so that equates to 8,000-9,000 patients every single year that we're interacting with on a daily basis. And we know that this problem is going to lead to downstream effects on their health: diabetes, hypertension, cardiovascular disease, and those sorts of things. And so we know it's a root cause of a lot of these things, and so we're going to do what we can to try to address it. And I think this program is one of many that's being offered.
So there's not one single solution to fixing this. Talk a little bit about what you're doing in your clinic to help.
Yes, we have several different initiatives. So one of the ones that we're most excited about is that we have a refrigerator in our clinic now that's stocked with food from harvesters every week. And this is actually a program that was driven by our medical students. And so a group of medical students, Vivek Panchanaman and the Community Health Alliance, it's a student organization, they came to us and they said, we got a refrigerator, we want to put it in your clinic, we've made the contact with harvesters already, we'll stock it every single week. And so they do all of that for us, and so we have it there, and if a patient is in our clinic and they're telling us that they're having trouble getting food, we can give them a week's worth of healthy food. And I think we've given out about 600 to 700 bags of food over the last several years on that. So.
Yeah, that's a lot. I know I have a cystic fibrosis clinic, and they often need 5,000 or 6,000 calories a day to sustain their body weight. Yep. And so that's hard. And so we have our own food pantry in the CF program that we raise money to help stock to get to patients. So it's great to know patients can leave the clinic with food, but Dr. Bridges, it takes a community approach. It's not just a physician's office, obviously, to help fight food insecurity. Talk to us a little bit about that.
Sure, that's exactly right. It takes a community approach because it's a community problem. As Dr. Gibson was describing, we have major disparities and inequities when we look at food insecurity. And food insecurity itself is a symptom of larger issues like unemployment, lack of affordable housing, low-wage jobs. If we map, and we have done this, all of our patients who indicate food insecurity, and we look at that, we see clusters. So we do see people all over the city, but we see clusters in Wyandotte County and on the east side of Kansas City and Jackson County. And if we map all of our patients with type 2 diabetes, we see the same clusters and many chronic diseases.
So it does run together with a whole host of things, and clearly if you have more chronic diseases, you're less able to work, and bang, here comes the food insecurity question.
Right, and healthcare costs. So lots of patients with food insecurity are also telling us our healthcare cost is high. So I think they kind of feed on each other. Once your health is poor, then you are less able to afford food.
Did the pandemic make all this worse?
It did. It did make it worse. So we've seen food insecurity rates go up. I think nationally it was right around 11% before the pandemic, and now we're at 13.5% nationally. But as Dr. Gibson said, if you look at communities of color, it's over 20%.
Yeah, that's just not acceptable, I don't think, in a country with as much wealth as ours, and to think that there are people out there who can't get access to healthy food, not just any food, but to even any sort of healthy food.
That's exactly right. And so it's not those individuals' issue, it's all of our issue.
We all bear a moral responsibility, I think. So I want to hear more about the Fresh RX program. Dr. Gibson, when did this start? Who's it for?
So we started in 2023. It's a USDA-funded program. We partnered with a number of different clinics. We have here at the Med Center, we have the Internal Medicine Clinic and Family Medicine Clinic, and Advent Health and Samuel Rogers. And so we recruit patients from these different clinics. Dr. Comfort has, I worked with him at the very beginning to see if he would be interested in working with us, and he was all in for it, and collaborated with a number of different physicians here to actually help us recruit. So it is for patients who are Medicaid recipients, who are pre-hypertensive or pre-diabetic or diabetic, and then have experienced food insecurity in the past year.
So we also give out some money sometimes, right, to help people go buy food. And it's not just we want to go buy go take this food, or let me try that again, take the money and go buy food. How do we do that? How do we give money to get to food?
So that each enrollee gets a card, and this card has been specifically designed to only for purchases of fresh fruits and vegetables. The enrollee gets $20 per week, and each person in their household gets $20 per month. So is loaded each month, and there's no tax taken. So it's a really unique card. And the 25 stores in the metropolitan area are Ball's food stores who have participated in our program. And they participated in our Double Up Food Buck program as well, which is another food nutrition incentive program.
Yeah, that's awesome. So now buying food is one thing, cooking it's another. How do you help participants know what ingredients to buy and how to use those?
So we have monthly nutrition education meetings with our participants, and these are led by registered dietitians. We have text messages, we have examples, we have videos that we share with them, and we talk about, food storage, food purchasing, those kinds of things. So we have a picture up with our registered dietitian, Rebecca Mout, who actually did food demonstrations, and the participants, I know Bastian liked that, showing them how to use fresh fruits and vegetables in their recipes.
That sounds pretty good with that. Now, Bastian, what was your experience like? How did using the produce cards go, and was it helpful to you?
Yeah, using the card, it was fairly easy. There was a few bumps in the road, but the stores were also always very helpful getting it to figure out. And then, just knowing that we had the ability to go get fresh fruits and vegetables was like, it was amazing knowing like we're actually going to have this in the house for a while, and we really, really enjoyed being able to do it.
What was your favorite recipe?
The one we did the most was one of the first ones we did, and it was like a vegetable dip that used either blended cottage cheese or like Greek yogurt, and we would eat it with like carrots or celery or peppers. That one it's still almost always in our fridge because it's
so
our favorite.
Good. That's awesome. Now, Dr. Gibson, Dr. Bridge, what kind of follow-ups are happening? What were you tracking? What kind of data are you looking at to know that people are doing better?
So we have a lot of data. So we administer surveys to ask them about their experience with the program, but we also get hemoglobin A1C and blood pressure measurements, height and weight, and also a Vegemeter score, which is an accurate measurement of fruit and vegetable intake. So quite a bit of data that's to evaluate the program, and that's what I lead for this program, is the evaluation portion.
Anything you want to add?
Well, in other pilots we've done at the university, we're measuring similar things. We are measuring mental health because we're seeing lots of connections there between mental health, depression scores, quality of life, too.
So this Vegemeter thing, well, that kind of sounds pretty fascinating. It sounds like a laser that can scan my finger for 10 seconds and figure out if I'm eating enough fruits and vegetables. All right, guys, come clean. How does that work? Is it real? Does that really do what it's supposed to do?
It's a valid measurement. It's much better than self-report because there's bias in self-report. So you put your finger in a little
like
clip.
A pulse ox?
Yeah, very similar to that.
I think I have one of those in my pocket. Keep talking.
So it shines a light and measures the carotenoids in your skin, the pigmentation, and so when you're eating more fresh fruits and vegetables, especially those that are high colored, you'll increase your scores on carotenoids. And carotenoids actually help with prevention of damage to cells. And so we really encourage people to eat a lot of different kinds of vegetables to actually increase their score.
That's pretty. So it's about that size. That kind of what it looks
very
like.
similar to that.
So it's pretty small,
very
pretty easy to
use.
put on. Easy. So can you get these just to check yourself? Can I order one off Amazon?
Well, they're very expensive. There are 3 in the Department of Dietetics that are used for a number of different research studies.
Okay.
Doesn't take very long. Typically, we can do it in a session. When we're doing our nutrition education sessions, we just pull people and ask them to sit down and put their finger in the little clip, and we're able to get their measurements. They love it because they can see if they're improving.
If they're doing it. Actually, that's an amazing level of reinforcement, but they're not available yet on Amazon, huh?
I don't think they're available on Amazon.
Okay, would you just try and Google that for just let's check out Amazon. All right, so after the first of the program, what were the outcomes like? Were people getting healthier with it?
Oh, really very positive results. So this is our second year, and we just got the data. So we know that over 90% was redeemed of those that received the cards. So that's a great thing. They're adhering to the program. Lots of people lost weight, although the averages stayed about the same. We had 59% of the sample actually reduced their hemoglobin A1C, 43% lowered their blood pressure.
That's pretty significant results.
And like Christina talked about, we did look at general health as well as mental health, and everybody seemed to be better general health reports, as well as 1/3 of our sample improves their food security.
That's awesome.
So we are very happy with those results, and we're looking forward to our year 3. So we've learned a lot from this past year as well as the first year to try to improve our program.
Bastion, did you get to do the veggie meter?
I did.
How'd you do on the veggie? Did your scores go up?
I believe, yeah, I think they did.
Yeah, that's awesome. A veggie meter. Okay, so now big picture, outside of this Fresh RX program, what else would we like to see happen to reduce food insecurity?
Well, I think it's important to involve community health workers. We've done pilot studies looking at giving boxes of produce to folks and seeing similar results, improving A1C, blood pressure, mental health. But then we looked again months and months after we'd stopped the study, and those who had worked with community health workers, who are folks that can help you address any issue that you may be experiencing, transportation, lack of housing, those patients actually sustained those benefits. And so I think that, combining, we need to give immediate food assistance to help improve access and improve health, and then continue to connect folks to sustainable solutions.
That is really awesome. All right. What else would you like to see happen to reduce food insecurity, team? Besides
a lot
massive
of
economic
things. So,
reform.
I live in the clinical world, so I'll say, I think health systems, clinics, hospitals have a role to play here, and I think we're seeing that more and more. Harvesters has been a great partner for us here at the University of Kansas Health System. I know they're partnered with lots of clinics around town, and so I think that's a really important part of this. I mean, I think lots of people interact with us every single year, so we have a role to play in this for sure.
I agree with Dr. Comfort that working with the charitable food system, food banks, so we have the Kansas Food Bank and Harvesters in Kansas, which are both great. Working with schools, Dr. Gibson and I both work with schools and local farmers. Actually, local farmers is a really great place to bolster that, the food system locally. But it does take that collaboration of all these different systems working together, because this is an issue with systemic roots.
Yeah, it is. So, Bastion, what would be the best thing to help you and your family and our team? What would be the best thing that would help you?
I know for us, our biggest thing is knowing that the access to that food will be there. Because, we get so much money in SNAPs every month, but after you spend just the basics for pantry stuff, it pretty much runs out. And then knowing that the food banks will have things. Our local food bank runs out fairly often, and they'll post on Facebook that their shelves are empty, and it's only a Wednesday, and so there's half a week still and there's no food. And so that's a really big thing that we deal with, knowing that will be there. And sometimes they have no fresh fruits or vegetables. You go and they might have a couple little bags of carrots, but that's all they've got. And so knowing that those things are going to be there when people need them.
Yeah, that is a big deal. All right, we're going to be here to answer your questions. Send them using the links on your screen with YouTube, Facebook, or email the Medical News Network. We're going to check in next, though, with Doc Hawk. All right, Hawkeye, we're officially in the respiratory viral season. It turned cold today, the coldest day of the fall so far. I'm noticing more people sniffling, coughing, and sneezing. My wife has had a cold. She keeps coughing. Talk to us. What are you going to tell us?
Yeah, so just like you said, we have to remember this and what we are in now have entered in is typically respiratory viral season is consisted of viral infections such as RSV, influenza, other common cough and cold viruses, but unfortunately also SARS-CoV-2, which causes COVID-19. So we do understand, however, COVID-19 is not necessarily seasonal like this respiratory viral season, but can occur through any season. We had a recent high or peak of viral circulation and illness a couple months ago. It has significantly improved, but it is still circulating out there in the environment, probably even more than influenza and RSV at this point in time. And what we do have is the current data shows that all the markers for respiratory viral illness including RSV and influenza, as I just said, and COVID-19 remain low at this point in time. In the last week or so, we have seen influenza activity increase slightly, but overall low in the country and locally here in our community as well. The most recent data we have from the health system is from last week, which started November 11th. And this graph really just shows the percentage of positive tests we are getting. Influenza is blue, RSV is orange, and COVID is green. And you can see flu and RSV remain low, but but have picked up a little bit. COVID was high, as you can see there, was getting low and kind of just ticked up very slightly last week as well. And then again, if we look at patients which were admitted to the hospital, there isn't much in the blue and orange, so RSV and influenza, although one inpatient with influenza. But COVID overall, Steve, like we have always talked about, we love when those COVID numbers are in the single digits. We have been in the single digits for the last couple weeks. So the viruses are circulating in the community. How do we prevent these infections? We know that there are important and simple steps to take to help prevent disease, including severe disease and hospitalization, which is vitally important for you, your family, and your friends. It all starts with vaccination. We know that we have safe and effective vaccines for COVID-19, influenza, and RSV. And even recently, Steve, we have seen data coming out on the vital importance of getting your RSV vaccination if you fall under that recommended group, how much it can help protect against severe disease and, of course, hospitalization. So hopefully most people have already received the vaccines, especially for influenza and COVID right now. If you have ever gotten one RSV vaccine, and again, the first year that it was out was last year, you are good to go at this point in time. You do not need an updated vaccine at this point in time. But for COVID-19 and influenza, you do need an updated vaccine. And unfortunately, the uptake is low, not only in the community as a whole, with adults and children, but unfortunately also with healthcare workers as well. But it's never too late to get vaccinated. Please go get your vaccinations. I know that I got my children doubly vaccinated or duly vaccinated for influenza and COVID yesterday. So hopefully they will stay protected through the respiratory viral season. It is still vitally important for children as well, because more data has come out even supporting the fact that vaccination against COVID, even though children don't have the propensity or the proportion of severity of disease as adults, the vaccination can significantly reduce their chance of getting that multi-system inflammatory disorder as well. So there are very prominent benefits of vaccine even for children. Other things that we can do to help reduce the chance of infection include frequent and adequate hand hygiene. Avoid putting your hands in your eyes, your nose, or your mouth. These are pillars of infection prevention, which we have always talked about. When we know that there are a lot of high-touch surfaces that we are coming into contact with every day out in the community, in our work, in our home, those high-touch inanimate objects can be vectors or areas where viruses may settle when we touch them. And of course, we know that people touch their face multiple times an hour. That can be one way which many people can be infected. So other important things to remember are also, please do not go out if you are ill. This includes work, school, etc. I know that's hard to do, but that is one way to otherwise help you get better because you're resting, but also keep others from getting sick. Also, it is always okay to wear a mask if you feel the need to or if you want to. We know that even wearing a mask when other people are not can help reduce the chance of you getting infected with these viruses.
You know, Hawkeye, it is a cold flu season, so thank you for that. It's an excellent reminder on the things we need to do. A little follow-up, mycoplasma pneumonia has been a bit of an outbreak for a lot of folks. We were just talking on the panel, and you said all the kids in one of your schools, everybody had it, or in the class. So we know it's real. So how's that going?
Yeah, I think that makes it difficult too. So we were talking about viruses. The mycoplasma pneumoniae, as you said, it's a bacteria. It is typically referred to as walking pneumonia. It's probably not the best name for it, but it generally consists of people not really being ill enough to be in bed at home sick, but having pneumonia, meaning lung infection. This can be accompanied with high fever, continued cough, like you said. It is treatable with antibiotics, so this is one one more thing now that we have to understand that we need to be evaluating for. Say if you're not getting better in a normal amount of time for a typical respiratory infection, or if you've been put on other typical antibiotics for respiratory infection or sinus infection and you aren't getting better, that medical team or that physician needs to consider Mycoplasma pneumonia as well.
All right, thank you, sir. We know many of you have questions. Let's head to Studio B with Alexis.
Hey, Dr. Stites, I looked it up for you. The veggie meter is not available on Amazon. It's $15,000 if you want to buy your own.
Awesome. Well, thank you. You know, you are an excellent reporter. We
Thank
already
you.
knew that.
Thank you. That's what I'm here for. Hopefully the price comes down.
Okay.
Okay, so Stuart has a question. He wants to know, is there evidence to show that food insecurity has gone up and become more common because the food prices have also gone up?
Oh, that's a great question with inflation and things like that. Team?
I'm sure it has. The latest data that we have that's been reported is 2022. So we don't have anything for 2024. At least it's not published, but I'm sure we hear a lot people are struggling to buy food at the grocery stores.
And all I know is it's harder to keep food pantries stocked. So if that is any indication, it's not, I think, from lack of
food prices, but also housing costs. So we see that tied together.
And transportation costs.
Right. So if you can't have affordable housing, then your food budget is a lot lower if you're paying a lot for housing.
So that goes along with Amy's follow-up question, is what is the root cause of this? Would you say it's housing, groceries, just not having enough money in the budget?
Probably not one thing.
It's not one thing. We do know some historic root causes for, I mentioned earlier, this map where we can map the neighborhoods that have the highest rates of chronic disease, the highest rates of food insecurity. And not surprisingly, those are the neighborhoods that were redlined in the 30s and 40s. So these were racist practices preventing mortgages, lending in those neighborhoods, and this really prevented families from obtaining generational wealth from home ownership.
Yes.
And so then this has translated to intergenerational wealth, intergenerational poverty that we see today. And so even though it seems like it was a long time ago, we're still seeing the impacts. Also,
and
those
you see it impacts schools. You see it impact how well you can eat. It impacts life expectancy. It impacts psychiatric and psychological health. I mean, so many things from redlining, as you pointed out.
So many things. Air quality. We're seeing now that these neighborhoods have the worst air quality across the country, but also in Kansas City was part of the study.
And then when you look at where I just saw something that came out yesterday, and even where we are spending money to build better roads, better sidewalks, bike and health trails, it's not in the same areas that got redlined.
Exactly. Yeah.
I have a question for Dr. Comfort. Dr. Comfort, in your training to become a doctor, were you trained in identifying food insecurity and knowing how to treat that?
That's a great question. So, no, I wasn't when I was, but we're doing it now. And so I know our medical students, that is embedded in the curriculum. They've done a great job of putting that kind of right at the forefront. So I think our medical students coming out today are certainly much more equipped than we were, but we had to kind of learn this on the fly, and I think it's something that I think we know is important, and we've kind of figured out how to learn along kind of with our students and everybody else. So.
Marie has a question. She wants to know, are there any restrictions on the kinds of produce you can purchase? For example, can you purchase canned or frozen vegetables? Because Marie writes those are less expensive. Or does it have to be fresh fruits and vegetables?
So the USDA restricts it to fresh fruits and vegetables because those are the most nutrient-dense types of produce. They restrict canned goods and frozen goods because of added sugars, added salt, and preservatives. So they want to make sure that they're promoting fresh fruits and vegetables because of the nutrient density.
And I would remind our audience that, canned, as you've just pointed out, canned vegetables and canned fruits often have lots of sugar and other things in them that links back to the problems we talked about earlier in the program with diabetes and obesity and other things.
Yeah, so the added sugars and the added salt are not good for people who are trying to lower their hemoglobin A1C as well as reduce hypertension.
Got it. And Stuart has one more question. Stuart writes, I'm so frustrated when I see food being wasted. Does reducing food waste overall help with food insecurity or food security in the big picture?
Yes, I think food waste, 40% of food is wasted in the United States, and so there's a need for innovative ways of distributing food as well as food storage that can really help with food security.
Jill has
Some
one
of
more
those
question.
Go for it. Go ahead.
In Kansas City, we have some organizations now that are doing these sort of innovative ways of, rescuing food that is still really good quality and taking it to corner stores to sell at affordable prices there, and then maybe, distributing also to food banks. So we have this happening now, which is really exciting.
Yeah, After the Harvest is a great organization that rescues crops, and so these are B-grade kinds of produce, but they're still good. I mean, and then they distribute it to food pantries.
Yeah, and then Canby's Markets is the one
Yeah.
putting it into corner stores, so in neighborhoods that don't have a full-service grocery store.
I was at a farmer's market a way back, and they were giving out cards for imperfect produce. And you could sign up to get any imperfect produce that wouldn't look as pretty in the store, but is still very nutritious. And it was a business that did it at a discount. I'll have to look that up. Jill has one more question. Jill wants to know, is there any improvement in nutrition helpful to overall health, even if I'm not improving my weight or my A1C?
Yes, absolutely. So we know good nutrition affects overall health, our entire body system, right? So we do see it improving A1C, we see it improving blood pressure, but it also helps improve immune system functioning, bone health. I mean, you name it. Good nutrition is going to affect every kind of health system or every organ system in our body. So,
Bastin, does your family just feel better when you're eating better?
Yeah, definitely. And we love snacking on it. We'll pre-cut all the veggies and stuff, so it makes it a very easy snack to go to, and I feel like it just really just helped us all feel much better, and like we weren't always just groggy and worn down from eating junk food. And we also found that we went for healthy food instead of junk food if it was in the house. If we had it there, we would go for strawberries before we went with for chips, and we loved it.
It's great like this. Guys, one last thing. If people want to make a donation or figure out how to go find healthy foods, what do they do? What's their step to do?
So they can donate to food banks. They can donate to harvesters. Harvesters always is accepting donations, and they're the largest food access program for low-income individuals. But the other thing that really needs to be done at a very much larger scale is SNAP. They need to increase the SNAP benefits.
Tell us what SNAP is.
SNAP is a Supplemental Nutrition Assistance Program. It's always been known as food stamps, but it hasn't been reauthorized in the Farm Bill, and so we have a new administration, and there are changes that are coming. They're fighting not to increase benefits, make people work in order to receive those benefits. So it needs to be reauthorized. People need that money to buy healthy foods.
Yeah, all right. I want to hear final thoughts before we end. A great program. But Bastion, I want to start with you.
I think programs like this are great, especially for people who may have not really eaten a lot of fruits and veggies. I know while in the program talking to people during the demonstration stuff, some of them had tried things they'd never tried before. Some of them had never had, butternut squash, and they never thought about putting certain beans in things. And being able to show people how to eat things can be very important, because they might see those things in a food bank and be like, I don't know what to do with this. But now that they've seen some of these programs and seen the food demonstrations, they now know what they can do with it, and it really opens people's world of different things. They're not always eating the same thing.
That's awesome. Dr. Bridges.
I want to remind everyone that food insecurity is not an individual's problem. It's a problem for all of us and our whole community, and it's everybody's work to address it.
Yeah, that's absolutely true. Dr. Gibson.
So I think we need more programs like the KC Fresh RX. It needs to be in more clinics because good things happen.
Dr. Comfort.
I just want to say a quick thank you. Use my time to say thank you to Dr. Gibson, Dr. Bridges for the work that you guys do every day. It's amazing. Helps make our community better. And then big thank you to Bastion. I just think, coming on, sharing your story to help others, that's something to be admired. So Thank you so much.
Hawk?
Yeah, I totally agree with all of that. We in our ID clinic also have a food bank there as well to help with our patients. This is such a vital issue as an individual, but as a community, and this is one of those other issues that we need to recognize about the disparities in the inequity in people's everyday lives, and we need to work as a community, either locally, statewide, regional, and nationally to help at least recognize these inequities and disparities and then try to find ways to fix them and lessen them as much as we can. So
It's a big darn deal, isn't it?
absolutely.
I say thank you to all of our guests, and especially to you, Bastian. It takes a little bit of courage to come on this program and talk about the things you've spoken about, and it makes a difference. So thank you for that. I want to say thanks to our audience. I talk a lot about faith, hope, and science. Hope and science are really important, but today I think was more about faith. Faith in each other to do the right thing and help lift all of us up. Because if we don't do that, we're leaving people behind. And at some moral level, that is just wrong. And so I think the point of people like those who work in harvesters or trying to renew the SNAP program, doing this research, and people are working hard to just keep their families fed. You got to have a little faith in each other that we are going to lift each other up, because that's where we find hope, and that's where science can make a difference. We'll see you next week. Thank you.
Feeling jittery and nervous for no good reason, Daryl says he knew something was physically wrong. I'm Alexis Del Cid on the next All Things Heart. Daryl's diagnosis was common. His solution would be a first.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.